If you need to transfer a patient from the bed to chair or chair to bed, and the patient requires a lot of assistance and cannot use a walker, you can perform a squat pivot transfer with the patient. Follow these steps to safely transfer your patient. Begin with the patient seated at the side of the bed, feet on the floor, and gait belt applied. The chair or destination surface should be angled toward the bed and positioned right up next to the bed. The chair will be positioned to one side of the patient. You should stand with a wide base of support, one leg in front and one leg behind. Lead with your foot that is on the opposite side of the patient than the chair. In this example, the chair is positioned to the healthcare worker's right side, and she leads with her left leg, placing her foot outside the patient's right foot. You will use that leading leg to support the patient during the transfer. You'll do this by interlocking your shins. With your foot positioned outside the patient's, move your knee towards your midline. In this example, your left leg would be leading, so to pull your knee towards your midline, you'd pull it to the right, crossing over the patient's shin. Then lock your shins by pressing your knee into the inside of the patient's leg. If the chair is on the left side, everything is mirrored, so lead with your right foot and cross midline by pulling left over the patient's leg to lock your shins. With your shins interlocked, have the patient lean into your shoulder, the shoulder opposite the chair. By doing this, they will naturally point their hips in the direction of the destination surface. In this example, the chair. So in this example, with the chair to your right, the patient would lean to your left shoulder. While holding the gait belt, shift your weight to your back leg. Bring the patient with you. Their bottom will lift from the bed, and you can safely pivot the patient and lower them into the chair. If the patient requires more than a one-person max assist, an additional healthcare worker can aid in the squat pivot transfer. The helper will stand between the bed and the destination surface, standing with a wide base of support. Their purpose is to provide additional support during the transfer. The two-person squat pivot transfer will mostly follow the same steps as with a one-person transfer. And with the patient leaning forward and shins interlocked, both healthcare workers will help lift the patient from the gait belt and guide the patient's pivot to the chair.